Lymphatic drainage is a gentle, rhythmic massage technique designed to stimulate the movement of lymph fluid, reducing swelling, relieving pain, improve circulation, and supporting the immune system. It uses light pressure to move fluid toward the lymph nodes. Perform the routine directly on the skin for better consistent movement, but it can also be done over clothing. Many wellness spas advertise lymphatic massage, but the techniques vary greatly. This instruction is centered around the European method. "60% of the human adult body is water. The unique qualities and properties of water are what make it so important and basic to life. The cells in our bodies are full of water. The excellent ability of water to dissolve so many substances allows our cells to use valuable nutrients, minerals, and chemicals in biologic processes. Water's stickiness from surface tension plays a part in our body's ability to transport these materials all through our cells. The carbohydrates and proteins that our bodies use as food are metabolized and transported by water in the bloodstream. No less important is the ability of water to transport waste material out of our bodies. The lymphatic system maintains fluid levels in our body and collects excess fluid and drains from cells and tissues throughout the body and returns it to the bloodstream, which is then recirculated through the body. It absorbs fats from the digestive tract. Lymph includes fluids from your intestines that contain fats and proteins and transports them back into your bloodstream. Lymph capillaries in the tissue spaces. Unlike the circulatory system, which is a closed system, the lymphatic system is open. Lymph originates in the interstitial fluid that leaks from the blood in the circulatory system into the tissues of the body. This fluid carries nutrients to the cells and collects waste products, bacteria, and damaged cells before draining into the lymphatic vessels as lymph. The lymphatic system is part of the immune system. Skin, mucous membranes, bone marrow, spleen, thymus, and tonsils. It produces and releases lymphocytes, or white blood cells, and other immune cells that monitor and then destroy the foreign invaders, such as bacteria, viruses, parasites, and fungi that may enter the body. It transports and removes waste products and abnormal cells from the lymph. The lymphatic system consists of many parts. These include lymph, also called lymphatic fluid. It's a collection of the extra fluid that drains from the cells and tissues that's not reabsorbed into the capillaries, plus other substances. Lymph nodes. Lymph nodes are bean-shaped glands that monitor and cleanse the lymph as it filters through them. The nodes filter out the damaged cells and cancer cells. These lymph nodes also produce and store lymphocytes and other immune system cells that attack and destroy bacteria and other harmful substances in the fluid. A few of the more familiar locations of lymph nodes are in your neck, your armpit, groin, and behind the knee. Lymph nodes are connected to others by the lymphatic vessels. Lymphatic vessels collect and filter lymph at the nodes as it continues to move towards larger vessels called collecting ducts. These vessels operate very much like your veins do. They work under very low pressure, have a series of valves in them to keep the fluid moving in one direction. Collecting ducts. Lymphatic vessels empty the lymph into the right lymphatic duct and left lymphatic duct, also called the thoracic duct. These ducts connect to the subclavian vein, which returns lymph to your bloodstream. The subclavian veins runs below your collarbone. Returning lymph to the bloodstream helps to maintain normal blood volume and pressure. It also prevents the excess buildup of fluid around the tissues, called edema.
The lymphatic system provides the central structure of the immune system. It is made up of an intricate network of vessels that connect hundreds of lymph nodes as well as several key organs. Flowing inside this network is our lymph fluid, which is a plasma liquid that flows in just one direction, beginning at the tissue cells of the body and moving towards the neck, where a filtered and enhanced lymph fluid empties into our veins and rejuvenates the blood with fresh plasma and white cells. Let's take a closer look. The flow of lymph fluid begins in specialized lymph capillaries, located just under the skin as well as surrounding internal organs of the body. The flow of lymph fluid begins as it is collected from the interstitial fluid found surrounding the tissue cells of the body. As our blood and tissue cells add and remove substances from the interstitial fluid, it is also taken into the lymph system. Once the fluid is pulled into the lymph vessels, it flows through the nodes and lymph organs where lymph is filtered and enhanced. The nodes store white cells and provide both a filtering and fighting function. Nodes add fresh white cells to the lymph, and if they detect antigens in the lymph fluid, they react with an inflammatory response and kill the antigens. Lymph nodes are located throughout the body and clustered near strategic vein locations, such as the elbow, knee, chest, neck, groin, armpits, and abdomen. The organs of the lymph system enhance the lymph, as well as assist with immune function in their own specialized ways. Let's begin with our tonsils, which provide a local defense at a vulnerable spot where we are exposed to outside antigens. Tonsils produce antigens to stop respiratory infections coming in from the nose and mouth. The tonsils also trap antigens and hang on to them so that immune cells can destroy them. The thymus stores immature lymphocytes, where they also mature into T cells before migrating to infected locations of the body. The spleen helps remove cells coated with antibodies as well as antigens. It helps break down and recycle red cells, and the spleen stores monocytes. B cells, T cells, and natural killer cells are the three primary types of lymphocytes circulating in the lymph fluid, which then migrate into the bloodstream.
The Vater method of manual lymphatic drainage, or MLD, is a specialized gentle and rhythmic massage technique developed in the 1930s by Dr. Emeril and Esther Vater to stimulate lymph flow, reduce fluid retention or edema, and enhance immune function. It involves stretching of the skin with specific light pressure, circular movements in the direction of lymphatic flow. Current treatments may have slight variations. Proper technique according to the European method of lymphatic drainage is just a light touch, no more than 5 grams of pressure. The reason being is that lymph vessels and lymph nodes can be found in the dermis of the skin, which is just below the superficial epidermis. Lymphatic vessels. Inside the lymph vessels are one-way valves keeping the fluid from backing up. How lymph fluid moves. Drinking extra water keeps the fluid thin and mobile. Exercise or movement. Gravity does a lot of the work to move lymph through the body, but exercise really gives that process a boost. That's because there's no organ supporting the flow of lymph, and its work to filter out metabolic waste and pathogens. The best way to keep the lymph flowing through the lymph nodes and lymphatic vessels is then back into your bloodstream is through movement. Deep breathing. One vital muscle contraction that occurs around the clock is breathing, thanks to your diaphragm, the muscle that sits right below the lungs. Engaging in deep breathing will really get the lymph moving. That's because the diaphragm helps pump lymph to your chest and into your thoracic duct, the largest lymphatic vessel. Deep breathing is key for everyone, but especially important for those with lymphedema or swelling. Massage. Getting massage is another form of muscle contraction that can enhance the flow of lymph throughout the body. That's because 80% of the lymphatic system is superficial, sitting close to the surface of our skin. The pushing and pulling of massage moves your tissue for you and helps to draw fluid into the lymphatic vessels. Lymphatic drainage massage will affect the superficial lymphatic vessels. Even a relaxing massage will help lymphatic function to some degree. Contraindications or concerns. First of all, pregnancy. Any high-risk pregnancy, no treatment with morning sickness or dental infections without doctor's consent. Sudden rapid onset of edema or swelling should be evaluated by the doctor first. Person should consult with doctor first before doing manual lymphatic drainage. Other concerns would be DVT, blood clots. Consult the doctor first. Any type of recent fracture. Heart, liver, kidney failure. General cancer or skin cancer. Rapid onset of edema or pain, talk to the doctor. Infection. Treating with antibiotics at least 2 days before is a must. Unidentified skin conditions. Flu or fever. After injectables, check with the doctor first. Recent surgery or scar, reroute the drainage. So contraindications: do not perform lymphatic drainage or compression until cleared by the healthcare provider if any of the following are present. Acute infections, deep vein thrombosis or DVT, congestive heart failure, kidney disease, active cancer, open wounds, skin infections in the treatment area, uncontrolled hypertension, acute inflammation or injury, thyroid conditions if untreated, pregnancy in the first trimester, severe arterial disease, liver disease, autoimmune disease flare-up, recent surgery less than 2 weeks, known allergy to products used. No-touch zones. Some employers have no-touch zones or special draping requirements. A good rule to follow is no more than 1 inch below the clavicle and halfway down the thigh. Glutes must always be covered. Treatment only permitted above the drape. The 3 main collection areas of lymphatic fluid. Looking in detail of the 3 main collection areas or superhighways, we start with the face, draining to the bottom of the neck to the clavicle. Each stroke consists of pulses. They are the cervical nodes, axillary nodes, and inguinal nodes. The neck and cervical lymph nodes are on the side, using a light touch of only 5 grams of pressure, slowly starting from the center of the face towards the ears, from the top of the head down to the ears, the back of the head to behind the ears. Special attention to around the eyes, going to the front of the ears. This is very helpful with puffy eyes or any areas that appear swollen. Drain around the mouth and chin to the side of the neck and to the clavicle. Treatment for the face. Using the pads of the fingers only, touching out to the sides of the face. This is the majority of where all of the lymphatic nodes are. From there, just systematically go to the rest of the face, above the eyes, below the eyes, into the cheeks, the nasal passages of the sinuses, also on the head, draining down into the sides and eventually getting down to the sides of the neck to just below the clavicle. Try to do each one of these strokes at least 5 to 10 times. No pressure whatsoever, only 5 grams of pressure. Always encouraging the person to do this as homework as well, especially if they have some moisturizing lotion that they place on their face. All of this lymph drains into the side of the face, down into the sides of the neck. These lymph nodes are abundant, and you'll find them just above and below the clavicle. Always draining down. It's a nice, gentle feel. It's very relaxing. Axillary nodes. The next superhighway is the axillary region. Drain the arm with the same light touch. The second of the main drains is the axillary or armpit area. From here, going across from the clavicle to the armpit. The front or the top of the shoulder. Here I'm going from the elbow to the axillary area to work and to drain that area first. After that's accomplished, then you could continue with the rest of the arm. You could go towards the inside of the arm, the outside of the arm. It's all draining into those axillary nodes. Again, only 5 grams of pressure. You could also use the palm of your hand to make it a little bit easier on you so you don't overwork your fingers. You could also go across from axillary to axillary. If any injury or scar happens to be in this area, try and go around that scar, not right on top of it, because it's not uncommon that those lymph nodes have been damaged or removed. Going from side to side. Continuing all the way through to finish the second of the main drains. At least 5 to 10 times each. The third main collection area or superhighway is the inguinal area. The 3 collection areas are of most importance because once they're open, the smaller nodes throughout the body can drain easier. This area is considered a no-touch zone and only used by the client for instruction or homework. Inguinal area drainage from the chest and stomach. Using a light touch, drain down from the chest and stomach to the inguinal area. This area is considered a no-touch zone and only used by the client for instruction or homework. Inguinal area drainage from the legs. Drain the legs up to the inguinal area. Be aware of the no-touch zone, which will start at the mid-thigh and higher. This area is considered a no-touch zone and only used by the client for instruction or homework. The third of the main drains is the inguinal area. There are numerous lymphatic nodes all around this area. So we'll start from the knee going up to the mid-thigh to get everything draining up from there. Using the palms of the hands as well, with only 5 grams of pressure. Once the mid-thigh has drained, then we can go to the lower part of the leg. This is very helpful, especially if there's any swelling or edema in the lower leg. Be sure not to go above the mid-thigh. Very simple and easy to do. Using both hands, it encompasses the top of the leg as well as the sides as well. This fluid a lot of times is stagnant. The treatment review, the superhighways or main drains. Start with the face and drain down to the clavicle. Drain up the arms to the armpit. Finish up the legs to the mid-thigh. This is the cornerstone of the treatment. Once these areas are open, everything else will flow better and receive the most benefit. And of course, always drink extra water. The side streets are secondary drains. Start from the armpit to armpit and back the other way, just below the clavicle. From the armpit to the inguinal area and back is a no-touch zone. In the prone position, from the armpit to the armpit and back again. The sacral area may be done over the blanket. These drains are smaller but still important. In this, the client is draining from the axial armpit area to the inguinal area, and then also back up again. No pressure. These drains are smaller but still very important. Next, in the prone position, we're going from axial to axial and back again. These lymphatic nodes are numerous. They can be found in the back as well. Here, there's a small cluster around the sacral area. The alleyways are third drains. Start from the hands to the armpit, going up only to the top of the shoulder, from the feet to the middle of the thigh. In the prone position, hands to the armpits, going up only to the top of the shoulders, from the feet to the middle of the thigh. These drains are smallest but still important. Make sure to do both sides. The alleyways or third drains are the smallest, and it's also the finishing moves for the treatment. So we make sure that we drain the arms just as we had done before. Tiny little lymphatic nodes, but still are very important. And we make sure that we drain the legs as well, up to the mid-thigh. Homework for the client. Every day the client should drain the first, second, and third drains. Once they do this, it establishes a habit, and it should only take a few minutes. Instruct them to drink extra water and limit their intake of salt, which causes the body to retain more fluid. Other than hands and fingers, a good alternative after a shower or bath is to apply moisturizing lotion in the direction of all the drains. Using a dry body brush in the direction of all the drains is also quick and easy. Be sure not to use any pressure. The dry body brush that I referenced earlier is a really nice kind of an addition. Not only does it exfoliate the skin, it feels good and it actually calms down the nerve endings. So with this, be sure not to use really any pressure whatsoever, just the weight of the brush is totally fine. And this could be used for all of the different drains. Sewing tape measure. A good habit to begin a session is to always measure the arms just below the armpit, also the thighs just below the no-touch zone. Be sure to document these measurements each time you see the client. Not only will you be able to see the progress the client's made, but they will become even more enthusiastic about the treatment. It's not uncommon to see a client lose inches after a few treatments. A good addition is measurements using sewing tape. So what I do is I place the tape around the middle of the thigh and document that measurement. From there, I will also do the arm just below the axial area. Every time that I would see the client, I would take a new measurement. Pitting edema test above the ankles. In the event of excessive swelling, a pitting edema test is done. Compress the tissue above the ankle for 5 seconds with good pressure. Any indentation that lasts more than 60 seconds shows positive edema. To take the education to the next level, instructional classes are available for treating specific edema reduction. These courses teach manual lymphatic drainage, compression bandaging, and therapeutic exercise for both acute and chronic conditions. Final thoughts. This treatment will benefit almost everyone through their life. People comment better energy, improves sleep, and supports every system of the body. The suggested time frame is 1 appointment every week for 1 month. Post-surgical treatment has been found to improve healing time, less swelling, reduced medication needed. Lymph vessels are in the brain. Discovered in 2015, they can also help with concussions. MLD is the only treatment so far.